mode.
And a big hello to everybody. Mike Martinego here of SportMedBC. We're so glad you could join us for our third SportMed Safety Webinar of 2014. We're doing a series of 8 webinars in all. We started this past August and we'll continue into early 2015. So far we've looked at shoulder injuries and hydration for sport. Tonight we'll be talking about the principles of stretching. Just before I throw it over to our Manager of Sports Safety and Event Services, Paul Dwyer, I just wanted to mention if you have any questions or any comments, any feedback, we'll try our best to answer to it throughout the webinar. There's a toolbar on the right-hand side of your screen that allows you to send us questions and comments. If we do not get to it during the webinar, myself and Paul will be able to respond to you post-webinar. As well, this webinar will be posted online at sportmedbc.com. and our YouTube channel within the next 24 hours or so. So be sure to check us out if you happened to miss anything. For now, I'll pass it over to our Manager of Sports Safety and Event Services, Paul Dwyer. And Paul will take us through best practices, principles of stretching.
Okay, thank you to Mike and thank you to those that are joining us tonight for Principles of Stretching. We're going to take a brief look tonight at a number of the concepts associated with stretching. So there is a lot of debate out there as to what are the proper techniques for stretching, is it a true benefit to people? So we're going to look a little bit first at understanding flexibility. With that, we have to discuss, of course, the dynamics of the tissue associated, mainly with muscle tissue. I'll discuss briefly why we stretch and what some of the benefits are. And then, of course, I'll get into some of the logistics around stretching principles and different types of stretching, as well as a few considerations. So when we're talking about flexibility, really what we're talking about is the ability for us to move a single joint or multiple joints really efficiently and smoothly through an unrestricted and, more importantly, a pain-free range of motion. So this flexibility, it's based on our musculotendinous unit's ability to elongate or lengthen when there's an added application of a stretching force. So that musculotendinous unit, we're talking about the section where we have the tendon, the sort of denser connective tissue that attaches our muscle to the bone, joining the muscle belly itself. So a few other things we need to talk about when we talk about flexibility is one thing, hypomobility. So when I speak about hypomobility, we're really talking about a restricted range of motion. So our mobility isn't as much as it should be, or it's reduced. A hypermobility, we talk about being an excessive range of motion, or somebody with maybe very excessive flexibility. And then lastly, I'm going to talk briefly just about contracture. So in terms of a clinical perspective, this is an adaptive shortening of the muscle tendon unit and the soft tissue surrounding a joint. And a contracture kind of comes about when somebody's experienced an injury or they've been immobilized for long periods of time. And then they experience a shortening of the muscle's normal length, and as well it can happen with joint capsules and ligaments as well, depending on the nature of the injury. So flexibility, what we're really talking about is a measure of our range of motion. So mainly when we're talking about flexibility, we talk about static flexibility. So this occurs when we have minimal or no movement. So our ability to move a joint to a certain length and without any more movement beyond that. And so this happens without much of a muscle contraction. And then we're going to talk about as well dynamic flexibility. So this occurs with active movement, so how much an individual can actually move their joints or muscles through a range of motion when they're eliciting a muscle contraction or making the movement themselves. So when we talk about range of motion, there's a few things that really are going to determine how much range of motion we can have. There's a number of things that will determine that, and a lot of it has to do with our own history and our own background in terms of sport involvement and in terms of our experience with injuries. But from a sort of physiological perspective, the mechanical response of our contractile tissue will affect how much range of motion we have. So there we're talking about muscle as being our contractile unit. It has the ability to expand and contract through muscle contractions. We're also talking about neurophysiological properties of the contractile tissue, and I'm going to get into those in another slide ahead. We're also looking at the mechanical characteristics of what's called the non-contractile tissue. So these are the tissues, the connective tissues in our body that don't have the capacity to contract and expand in an elastic way like muscles do. So here we're talking more about joint capsules. So this is the fibrous connective tissue that surrounds our joints. We're talking about ligaments. These are the more dense connective tissue that travel around our joints and in the middle of our joints to help stabilize the joints and give us some feedback about where our joints are in space, as well as cartilage, which sort of cartilage supports or protects our joints when they contact each other. And then lastly, the structure limitations of the joint itself, and of course the patient's threshold or the athlete's pain threshold in terms of moving through a range of motion. That's going to determine how much we can move. So looking mainly at these neurophysiological properties of muscle, there's sort of two main components that actually control the muscle tension and the muscle length, and this is at a really cellular level. One thing we look at, if you look at the picture in the upper right, is muscle spindles. So the muscle spindles are located within the muscle fibers, and really the muscle spindle reacts to an aggressive stretch of the muscle, and with that it gives feedback to the spinal cord, and then it will give us a response or a reflex where the muscle will contract to protect it from an excessive stretch. So that's the muscle spindle. Similarly, on the other hand, we have the Golgi tendon organ. The Golgi tendon organ, as it says in the title, is located more in the tendon or the musculotendinous junction, and this is really sensitive to muscle tension. And what the Golgi tendon organ will do will actually relax the muscle in response to tension, but it's usually in response to a sort of slower or controlled passive type of tension. So it has a high threshold for this stretch in a passive way where perhaps you're moving the muscle through a range of motion yourself, or you've got a partner who's stretching you. So those two components have a really big capacity to control muscle tension and muscle length. When we look at the connective tissue, mainly there are the tendons that have a role. Obviously, they are responsible for attaching the muscle to the bone, and they'll really transmit a lot of the force during muscle contraction. And of course, this is part of that really important musculotendinous unit, and that's often where we experience a lot of injuries. And the tendons have a really high tensile strength, meaning the ability to pull lengthwise. Ligaments, they attach bone to bone, as I said, and they protect our joints from going through excessive bending, and they also provide us with sensory information. An overstretch of the ligaments can lead to stretching and maybe tearing. That's what we look at when we have a sprain. When we experience an overstretch, it can lead actually to a lot more instability in the joints. So we don't want to have excessive flexibility in joints themselves. And with that, ligaments can also become stronger with exercise, so it's important that we remain active so that they're strong and can withstand the stretch. And then lastly, fascia. The fascia is what spans over top of our muscle groups. It binds the muscle together and helps the blood vessels and the nerves and the muscle tissue work together and flow efficiently. And this tissue is quite weak and thin, and it can be subject to tightness as well. So why do we stretch? So as an athletic therapist, clinically, some of the reasons why we encourage people to stretch when it comes to injury prevention and injury recovery is when people have experienced some hypomobility. So if you remember, hypomobility is when we have limited range of motion. So the reason why we stretch in this case is to try to increase a range of motion, whether it be through this contraction or shortening of the muscle, adhesions where tissues are sort of stuck together, maybe scar tissue is formed after an injury, or if someone's been immobilized and not moving for a long time, or if they've just had a really sedentary type of lifestyle, mobility is going to help a lot with that, and stretching will help. Muscle imbalances are sometimes something that we see in a clinical setting. So what we'll aim to do is actually lengthen tight muscles while we try to strengthen the opposing weak muscles on the other side of a joint. So if you've got really tight hamstring muscles, we want to loosen those up and then strengthen muscles on the opposite side as well. In terms of spasming after injury, sometimes we'll use stretching to help relax the muscle. And of course, we want to overcome any contractures, so we'll help to lengthen a shortened muscle following an injury or immobilization. So some of the benefits, there's many. As you know, it's inherently within us all, even animals, as you can see on the right, that stretching, obviously, it feels good. It makes us feel a lot better. But some of the actual benefits, athletically and just for the general population, is to increase the range of functional movement. So obviously within athletics we need a great range of movement depending on our sport, and it'll help to increase our range of functional movement. So as we move our body through multiple ranges of motion, stretching can help. Obviously it can help reduce the incidence of injury. A longer muscle can withstand further ranges of motion than a shorter, tight muscle, and with that obviously will decrease the severity of injury as well. It can help to relieve muscle cramps. It can help with delaying the onset of muscular fatigue over time. And it can also help with prevention and reduction in muscle soreness after exercising. So implementing a stretching program after workouts is key to helping to reduce that muscle soreness you'll experience through strengthening and endurance training. Also, an increase in skill and muscular efficiency can be felt, and that's really about one, understanding your joints better, understanding your muscles better, but also ensuring that the muscle can move through a maximum range of motion, which will give you more biomechanical efficiency and sport efficiency. And lastly, relaxation. Relaxation not only of muscle tension, but then also of general stress and tension. Implementing a stretching routine can be really beneficial for overall health benefits and state of mind. And I think that the boom in yoga practice in the West is really speaks to the truth of that as well. So in terms of stretching, when we're looking at stretching, there are a few really important principles that we need to think about. Alignment. Alignment really is about making sure that we have specific positioning of our joints to target certain muscle groups. Intensity. When I speak of intensity, and with stretching, whether it be static stretching, dynamic stretching, we want to approach it with low intensity. It shouldn't be a forceful muscle contraction, nor should we go through a range of motion that causes pain. We're low intensity, mild discomfort at the most, not painful. In terms of duration, there's a lot of debate out there, and it really depends on the type of stretching that you're doing. We've heard lots of different things in terms of static stretching, about 20-second holds all the way up to 2 minutes, and with passive stretching, maybe even holding for 10 minutes to get a real stretch of the muscle. But really, when we talk about static stretching, there's sort of a universal agreement that 20 to 30 seconds is adequate in terms of a static stretch. But again, there is much debate about this, and it really depends on the type of stretching. So in terms of speed, as I mentioned, slow and controlled is what we aim for. If we go really rapidly, this can go back to, as I spoke about before, the muscle spindles or that stretch reflex. We want to avoid that. So as we're going through stretching routines, we want to make sure that we're not moving too aggressively and putting the muscle into a stretch that will elicit a contraction to protect it. In terms of repetitions, it really, again, depends on the goals. But with static, we often try to encourage people to do 2 to 4 repetitions of those 20 to 30 seconds. And when it comes to dynamic stretching or these active sport-specific movements, typically we look to do about 10 to 12 repetitions or more. But often when we talk about dynamic stretching and we're moving, people like to cover a certain distance, and it's not so much about repetitions, but maybe traveling over 30 to 40 meters while they're doing their dynamic movement. In terms of how often we do it, well, it's dependent on your goals. If somebody's coming back from injury, they might be stretching quite frequently. If somebody's deep into a training program, they might stretch really frequently, whereas somebody who is just starting out with stretching and try to improve overall flexibility may not be doing it quite as often. And then your mode is really just about how you are going to do the stretching. So whether it be a self-stretch, a partner-facilitated stretch, or using different equipment and tools to help you, like tubing, pulleys, etc. So I'm going to talk about types of stretching. Each of these could really have a long lecture in and of themselves, but we'll look briefly at each of these. Dynamic or active stretching, PNF stretching or proprioceptive neuromuscular facilitation, static stretching, and passive stretching. So starting off with active or dynamic stretching, flexibility exercises here are performed by the athlete without any assistance. So these are best performed before we start a training session or a competition. But one thing that we want to make sure is that we want to increase our core temperature before we actually begin these dynamic movements. And that's essentially because our core temperature can help with reducing stiffness in the muscles, and it'll actually increase the tissue extensibility or the ability of the tissue to stretch. So therefore, we need to have a good warm-up as part of our dynamic stretching routine. And this is involves jogging, running, doing sport-specific movements, and we typically want to start from sort of more simple movements, moving up to complex movements. And these are going to involve multiple controlled repetitions, as I mentioned before, 12 to 15 or over a distance. And all of these movements are going to involve multiple joints or multiple planes of movement. So we're not moving just one joint at a time. We're actually moving through really sport-specific movements that we'll have to experience in our sport. And the reason for this is we're looking to enhance our neural activity, build coordination, and prepare our muscles for what we're about to do. So I've just included some examples here of dynamic exercises. So you'll see this football group prepping, and they're doing some perhaps squats or lunge walks. We can also do leg swings, walking knee tucks where we're pulling our knee into flexion, high knee steps, hamstring stretches where we're reaching down and touching the ground, trunk rotations where we're getting full range of motion of our spinal cord, and arm swings. There's multiple exercises that are dynamic movements that are sport specific, and like I said, we're aiming for general and then working our way into more dynamic or complex movements. Proprioceptive neuromuscular facilitation. If we break it down, it's about the stimulation within the tissues that provides information or feedback to our spinal cord. So that's the proprioceptive part. It's at a cellular level. Neuromuscular really just means the interaction of our nerves, which actually innervate and make our muscles work. And then lastly, the facilitation comes down to the promotion of improved function through the use of these proprioceptors and our neuromuscular system. So this will involve combining passive and active exercises and all sorts of different contractions. Isometric, where we are in a stationary position, giving a muscle contraction, concentric or bending, and eccentric lowering or breaking types of contractions. And this is often controlled by a professional or a trained therapist, and usually in a rehabilitative setting. And it can involve a series of functional movements and techniques that aim to increase range, strength, and coordination based on neurophysiological properties. So a few examples are hold, relax, contract, relax, slow reversal, and agonist reversal, and then also some patterned movements that really help to get the athlete or the patient back to their normal function. So you'll see here on the right with the picture that we're actually having this therapist resist the athlete through shoulder extension, abduction, and internal rotation. Static stretching is the one that we all seem to know about and have a lot of experience with. And this involves holding a position with our joints fixed over a longer period of time. The key to this is muscle fiber alignment. So we're really trying to align the fibers so that we're targeting a specific muscle group, and we're doing this with a lot of control and no movement. So we can do this on our own or with the assistance of equipment. So typically we're looking at doing this after a training session to help the muscles to slowly elongate and go back to normal length or improve length. And we're typically looking at 20 to 30 second holds. So I've just put up a few pictures here to show some examples, and you'll see the top left picture where we're facilitating the stretch using a towel for the internal rotation of the shoulder. The upper right shows a lower back stretch, and then my all-time favorite stretch is in the bottom right-hand corner, and this is a hip flexor stretch that then involves the lat muscles or the back muscles, as well as the oblique muscles as you move through the added ranges here. And lastly, passive stretching. This will involve an individual not contributing to generating the stretching force, so there's no muscular involvement here. So typically this is performed by either a partner or a therapist or also with equipment. And our aim with passive stretching is that it can be more effective in actually helping to improve muscle length over time. And this is mainly due to the duration being longer as well as the force being greater than an individual can do on their own. And as I mentioned, this is often used in a rehabilitative setting. Lastly, I want to leave you just with a few considerations, mainly around youth and elderly populations. So youth, flexibility is a unique thing. Typically, they're a lot more flexible due to greater muscle and ligament extensibility. So children are quite flexible by nature. But if they're not and they have a sedentary lifestyle without the proper flexibility, they won't have the capacity to learn sporting movements, especially the motor patterns that are associated with sporting movements. So flexibility is really important for children. And it is important if you're facilitating children's stretching that they don't excessively stretch the joints and ligaments. They're not maybe aware of what their maximum length is. And we want to avoid that because children can have a capacity to maybe stretch the joints and create an instability by stretching their ligaments and joint capsules. Now, when we talk about elderly, the flexibility as we age will typically start to decline, and this really has to do with changes in our tissue dynamics, less water content, increasing fibrous tissue, and muscle typically becomes less extensible. So they'll have a lot more decreased mobility just by nature, and so we want to be careful when working with an elderly population that there's a lot of guidance with stretching, and this also has to do with their decreased kinesthetic awareness as they age, decreased balance, obviously decreased strength, and also the dynamic tissue changes. So I want to thank you for joining us tonight. My advice to you is definitely to make stretching part of your daily routine or your sporting routine. If you have any questions, please let me know, and I will pass it on to Mike. Thanks for joining us.
Great stuff, Paul. Thanks again, and thanks to everyone for tuning in and passing along their thoughts. along the way here throughout the webinar for tips and tools, resources, a variety of information on courses and events. Be sure to visit the new-looking SportMedBC.com. The webinar will be posted online within the next 24 hours or so. Paul mentioned how to connect with him. For more from SportMedBC, visit us in a number of ways online. Of course, our website, SportMedBC.com, on Facebook. And as you see there, Facebook.com/SportMedBC, Twitter.com/SportMedBC, and our YouTube channel, where you can find this webinar and so much more, as well as a variety of video tips on stretching, on taping, etc., etc. Our next webinar, November the 19th. Stay tuned for details, and be sure to check back for information and updates through our website and various social media channels. For Paul Dwyer, I'm Mike Martinego. Thanks again for checking out this SportMed Safety webinar.